Good morning. Welcome to all our students. I really miss you due to the extraordinary circumstances and the challenges faced by corona uh, virus. However, this challenge has resulted in this innovative way of approaching you and contacting, dealing with you. We remain thankful to the authorities of Rural Medical College for providing us an opportunity to talk to you on this important topic. Uh, Today, we want to talk about the surgical aspects of the structures in the mediastinum. The lecture shall cover the anatomy of the mediastinum. It will classify the tumors of the mediastinum, and it will describe the clinical features and investigations and treatment of the mediastinal mass. They all these topics they concern under they come under the cognitive domain, and an MBBS student is supposed to know all this. Now the anatomy uh, of the mediastinum. Mediastinum is the central area of the chest between the thoracic inlet and the diaphragm, between the right and left pleural spaces. It extends from the inner aspect of the sternum to the vertebral column, and it contains the heart, the great vessels, and the esophagus. The sternum is arbitrarily divided into the compartments, the superior and inferior, and the inferior is further subdivided into anterior, middle, and posterior mediastinums. Many of the regional lymph nodes chains draining the chest and its organs are found in the mediastinum. The superior mediastinum lies in the plane extending from the lower margin of the manubrium sterni to the lower margin of the fourth thoracic vertebra. It contains the upper trachea, esophagus, aortic arch and its branches, and thymus gland. If you see the diagram, this is the lower limit of the superior mediastinum. The upper limit, it opens into the neck with the first rib and the its attachment to the vertebral column. And anteriorly, it is the notch of the manubrium or the upper border of the manubrium which defines the superior mediastinum. On this side, you can see that there is a dry line here, and this contains the superior mediastinum. The middle, the posterior and the interior mediastinum are below the superior mediastinum, and they occupy this. This all division is arbitrarily made and is intended to convey us the location of any tumor or the mass. Anterior mediastinum lies in front of the anterior border of the heart and contains thymus, which can come from the superior mediastinum, adipose and areolar tissue containing the lymphatics. In the middle mediastinum is a trigonal area with base on the diaphragm and sides formed by anterior and posterior mediastinum. It contains pericardium, heart, aorta, tracheal bifurcation, main bronchi, and bronchial lymph nodes. Posterior mediastinum is bounded anteriorly by the middle mediastinum and by bodies of thoracic vertebra. Anterior surface of the ribs also form the boundary. Inferiorly, it is the diaphragm, which limits the posterior mediastinum. It contains esophagus, descending aorta, sympathetic and intercostal nerves, and the mediastinal nodes. Now, if you can see CT, it can give you an idea where the mass is. You can see over here, this is seen in a anterior mediastinum, or it could be in the superior mediastinum, depending on the, if you take another view, you will find out where it is. Now here you can find that there is a cyst or a tumor or a mass which is in the middle mediastinum, and it is displaying the carina. You see the main bronchi below the corona, left and right, they are separated by the cyst. Now, in the posterior mediastinum, neurogenic cysts are more common. You can see here in this diagram, this is the posterior mediastinum, which is having a cyst with a good wall, probably benign, because it is well encapsulated. So, the idea of behind dividing the mediastinum is to have the uh, guess or some idea as to what could be the structure, what are the structures, and therefore what could be the pathological structures which can arise from the structures which are already there. Like in superior mediastinum, which is an extension of the neck, you can have normally either a thymus gland or a thyroid thyroid gland, which may and parathyroid, which could be ectopic or could be an extension from the cervical tumors or the growths. In the anterior mediastinum, some of the entities or structures which are present in the superior mediastinum may even gravitate down and come into the anterior mediastinum. There, the thyroid, the thymus, uh, and the parathyroid are common. In addition to that, there could be dermoid cysts, there could be germ cell tumors and lymphoma, and the lymph node structures with vaginal camera tumors. In the medial mediastinum, it is the bronchus and the pericardial cysts, they form the majority of the masses. In the posterior mediastinum is usually comprising of neurogenic tumors and enteric cysts. Thymus gland is a very important gland. It is a specialized primary lymphoid organ in the immune system. Within the thymus, the T cells mature. The T cells are critical to adapting the immune system, where the body adapts specifically to foreign invaders. It is thymus gland is located in the superior mediastinum and has got two lobes containing cortex and medulla in each and surrounded by a capsule. Is thymus gland is active and large during neonatal and pre-adolescent period. By early teens, the thymus begins to decrease in size and activities are gradually replaced by fatty tissue. It occupies the anterior, superior and anterior compartment. It can have a, the abnormalities of thyroid which can result in decreased T cell activity. Now, since the T cells are important for autoimmune system, they may have an effect on the autoimmune systems, and the abnormalities can result in autoimmune poloendocrine syndrome type 1, in which most of the autoimmune systems are involving the endocrine systems, and other one can be the disease can be a myasthenia gravis. Now, this myasthenia gravis, what it causes is it produces antibodies which block acetylcholine receptors. That causes early fatigue of the muscular movements. Now, it could be the uh, the growth in the thymus, benign or malignant, which will cause the thyroid interference with the thymus functions. If say mm, if it is a thymoma, that means it is a cancer of the tissues of the thymus or a tumor of the thymus, mostly malignant. Or it could be the lymphoid tissue with the thyroid thymus gland, which can increase. The results are both of them will have an if interference with the working of the thymus, and it will cause the tumor effect. Now, the treatment of thymus tumor is called, it can be by removal of thyroid, we call it thymomectomy, or it could be by a radiotherapy. Now, once the radiotherapy is given in the beginning, chemotherapy is given, and if this the mass still persists, then there is the indication for the surgery is there, and we call it a thymomectomy. Usually thyroid can be removed by either a cervical approach or by a VATS procedure, which can be added to the cervical incision. You can see the thymus and other growth in the superior mediastinum. You can see this here in the now the second mass which can be there is germ cell tumor. You know, germ cell tumors are a different type. One is gonadal and this is extragonadal. The mediastinum is a preferred site for the extragonadal germ cell tumors. It is the 13% of all mediastinal masses and cysts are from the germ cell tumor. 70% of these germ cell tumors that are found in the mediastinum are usually benign and cystic, but they cause pressure symptoms, while the rest are suspected to be malignant. And the malignancy can be suspected if the tumor markers levels are increased. And tumor markers here are serum alpha fetoproteins, human chorionic gonadotropins, and carcino and embryonic antigens. If they are increased, it indicates that there may be the possibility of a malignant germ cell tumor present in the mediastinum. More important, their measurement of these levels are after the surgery or radiotherapy. If the levels go down and after on the follow-up, if they increase, that indicates that these are there is a chance of recurrence. Lymphoma. Lymphoma are common cause of mediastinal mass lesion. They are present in the if they are present in the anterior mediastinum, they are likely to cause compression of the superior vena cava and hindering in the venous drainage. The lymphoma can be from the normal lymph nodes or the lymphoid tissue in the thymus. Now, this could be Hodgkin's type and it could be non-Hodgkin types. Hodgkin type is more with more favorable histology and it is localized. And non-Hodgkin lymphomas are high grade and common in young adults. The tissue diagnosis is required and surgery is rarely indicated except for diagnosis. You can see the middle mediastinal lymph nodes or masses. The mesenchymal tumors are 50% of them are malignant. They can be lymphoma or liposarcoma or fibrosarcoma, mesothelioma can also occur. Now, these thyroid tissues can be neoplastic or hyperplasia. It can the goiter can be of any type, and they can cause symptoms by their size, and they cause pressure symptoms. The extension of thyroid into the superior mediastinum is called retroesternal goiter. The pressure symptoms are produced early as there is no scope for expansion. And the treatment of a thyroid tumor is either by a cervical incision, which is usual, and in very rarely a midline stenotomy may be indicated. The neural tumors are usually found in the posterior mediastinum, and the source of origin is either autonomic or the peripheral nervous system. They may be present as an incidental finding when X-ray is taken for some other reason, or they may present with tumors. The sympathetic cystic tumors are present in less than 10% of cases. Neuroblastoma consists of poorly differentiated pigmented cells. With wide metastases on these tumors, they make their prognosis poor. Ganglioneuroma and ganglioneuroma depending on the age, the ganglioneuroma will occur in the younger children, and ganglioneuroma will occur in the adult system. And adult also develop cystomas and neurofibromas with pressure effects. Now, Fuchs chain with immune system can also present here. And the lymph node, the metastatic tumor in the lymph nodes in the early stage can also be found in the posterior mediastinum. Now, mediastinal masses or the tumors can have a varied type of clinical presentation. They can be asymptomatic, we call them incidentalomas, which are found on X-rays taken for some other reason, or they may cause pain. There can be a compression or pressure effects. So if it is in superior mediastinum, it will cause superior vena cava obstruction with engorged neck veins and redness on the whole of the face. Or they could cause tracheal esophageal compression if they are in the middle or posterior mediastinum. They may involve the nerves, and there can be even they can involve the nerves as well as the pericardium, and the spinal cord can also be involved by these tumors. Now, investigations. X-ray chest is the primary investigation. This will show us the mass. If AP and lateral views are taken, we can easily assess which part of the mediastinum is involved in this. Then we have got a mediastinoscopy, CT or MRI, the tumor markers, and biopsy. Now, bronchoscopy has got a very limited role, but if the tumor has invaded the bronchus or there has been a pressure effect, that can be assessed by this. If there is an mediastinal, we have got a rigid as well as a flexible bronchoscopes, which are used to assess the bronchus and bronchial tree mainly, but they can be assessed outside because we can take a biopsy from any lesion outside the bronchoscope once it is done assessed by ultrasound. Now, this is excellent for endotracheal behaviors, and we can take a biopsy also. Now, this endobronchial ultrasound is an advancement. This is a ultrasound passed through the bronchoscope on as an attachment on the bronchoscope. It can assess masses outside the bronchial tree. You can see in this diagram. Now you can aspirate through the transbronchial needle and take a biopsy. The sputum cytology will again be more helpful in cases which has got a bronchial extension or there are bronchial lesions, but not a mediastinal lesion. The PET scan, of course, will detect any type of activity in the chest, including the lungs or in the mediastinum. The treatment of mediastinal masses is primarily, if they cause symptoms, is resection. The surgical approaches of there are surgical approaches for the treatment of mediastinal masses will depend on where the structures are. When the tumors are in the superior mediastinum or in the inferior anterior middle. For anterior mediastinal tumors, the midline sternotomy is preferred, while in the posterior mediastinum, it is either the open thoracotomy or VATS, video assisted thoracoscopic surgery, thoracoscopy surgery is the preferred one. Now you can see the surgical approach to the lung is via thoracotomy. The right and left thoracotomy, depending on the which side of which mediastinum we want to operate, can be chosen. Now, video-assisted thoracic surgery is very advanced and a practical procedure. Without opening the chest, because it has got its own morbidity, you can approach lesions in the mediastinum. Once you are inside this, and the telescope is there inside, this lung can be deflated by stopping the flow of air and oxygen through this, and the collapsed lung is displaced, and the structures in the superior or the posterior mediastinum can be easily approached by this method. Post-operative care for thoracotomy is very dedicated, and because if the thoracotomy is done, it's a measure of surgical onslaught, and infection fluid overloads are to be avoided. Drains have to be put, and they can be removed after checking post-operative air and when the leaks have settled. Mobilization breathing exercise for a case like this is necessary. Now, these operations, they carry its own complications. There can be bleeding, there can be respiratory infection, there can be, if the lung has been injured, there can be a percutaneous leak, or if the pleura has been injured, there can be a bronchopleural fistula. In summary, tumors of the mediastinum represent a wide diversity of disease state. Clinical spectrum of mediastinal masses can range from being symptomatic to produce the one which produce compressive symptoms. CT and MRI are important for diagnosis, and VATS is a new intervention mobility. This you can see the video assisted surgery where the image of the neurogenic tumor attached to the posterior lateral chest wall prior to the excision. The references are short practice of surgery preferred 27th edition is available and the other one. Thank you for your attention.